Mommies. Today I want to talk to you about two medications for benign prostatic hyperplasia, so BPH. So the first one is going to be Tamsulosin Flomax. It is a alpha adrenergic blocker. It blocks alpha-1 receptors, which relaxes the smooth muscle of the bladder. And so it works locally. Then we have finasteride, which is also called Proscar. And finasteride works differently. It works to reduce the androgen level in the body by, it's a 5-reductase inhibitor. So 5-reductase is an enzyme that helps convert testosterone to DHT, or dihydrotestosterone, which is a much stronger androgen. And so by blocking this conversion, we reduce the amount of androgen level in the body by about 70%. So I have a way to help you remember this. We have Tamsulosin, which is on our man working locally, and it's an alpha blocker. And so one thing I want you to think about with Tamsulosin, as far as your nursing interventions go, what do we remember about our adrenergic blockers? That's the same category where we find our blood pressure medications, our metoprolol, our prazosin. All of those kind of medications can work by relaxing smooth muscle, which reduces blood pressure. So if you're taking Tamsulosin, you have to be careful that they don't have any orthostatic hypotension. So you're going to want to have them get up slowly from a sitting to a standing position, especially when they first start using this medication. All right, so that's Tamsulosin. The LO in Losin can help you remember that it works locally. Our second medication is finasteride. Finasteride is a 5-reductase inhibitor, and it works by converting T to DHT. That's how 5-reductase works. And so finasteride works by blocking that. So T does not become DHT when we use finasteride. And you can remember finasteride, the fin refers to a 5. So finasteride is a 5-reductase inhibitor. And it also contributes, DHT also contributes to male pattern baldness. So you can see that our little guy is bald. So one of these meds that we have works locally, and another one works on our hormones in the system. So there's a third medication, and we've already talked about this med when we did our CAM therapies, and that's saw palmetto. Saw palmetto is an over-the-counter medication that can be used and can be somewhat effective on reducing enlargement of the prostate. So think about those meds, think about your nursing interventions. Remember that the whole point of these meds is to help our patients have an easier time urinating. When you have the enlarged prostate, it blocks urination. So if we're evaluating, we need to evaluate for the pattern, frequency, and if they're having nocturia. So that's how you evaluate urine output, right? When we're talking to our patients. So if we want to see how effective the medication is, we have to talk to them about the pattern, frequency, and whether or not they're having nocturia. All right, thank you guys. Have a great day.